Hello, I'm Dr. David Thomas. I'm a practicing psychotherapist in Tampa, Florida, to talk to you today about how to cure chronic depression. Some of the materials you might need would be a quiet place, a piece of paper and a pencil, or a journal in order to reflect and to be able to record your thoughts. Before we begin on the cure for chronic depression, let's look at what chronic depression is, how we define it. Chronic depression, clinically speaking, is what we call dysthymia. It doesn't tend to be a debilitating depression. It tends to be kind of an ongoing depression, unlike major depression, which tends to be very debilitating. Chronic depression is kind of there all the time. It never really goes away. It's kind of in a state of that you're not happy, but you're not really extremely unhappy. Now, at times with stressors and all that, that chronic depression can elevate, not necessarily to a major depression, but can certainly elevate to where it interferes more. Now, chronic depression or dysthymia is probably the most difficult depression to cure, if you will. And when we talk about cure, it's kind of an interesting term because what we want to try to do is to eliminate or to minimize the depression, recognizing that depression can always reappear. Now, depression and chronic depression tends to be a reflection of thought. So if you want to minimize or cure chronic depression, it's very important to continually work very hard and practice at changing your thinking. The model we use in regarding to changing thinking is what we call the ABC model. The ABC model is a very simple model to learn, a little more difficult to practice. The A of the model stands for activating events, stressors, things you're depressed about. The C in the model is the depression or the subsequent behaviors, and the B in the model is beliefs. It's what you tell yourself about the activating events. And so you go about changing that emotion, that depression, by challenging that thinking. The thinking we're most concerned about is the irrational thinking, not the rational thinking. The rational thinking produces an effect that we tend to like, that we tend to get to positive effects with. It's more adaptive. So how to determine the difference between rational and irrational thinking? Simplest way is your thinking fact or is it fictional? If it's a fictional, you replace the belief with a more rational belief, and you work very hard in practice and making that change. It's really a lifelong process. You just get better at it and get better at it and get better at it. I'm Dr. David Thomas talking to you today about chronic depressions, its cure.